I was going to ask you actually, Tom, I mean, what advice would you have for athletes in terms of their hearts and symptoms?
Well, I think, well, first of all, I mean, it's a significant condition that it's something the more people know about it and the more greater awareness about it, then you can save yourself an awful lot of problems and prevent further risk later in life. And actually, I've seen the other side where when you do have AF and it doesn't get treated, that it can become permanent, and then you've got a permanent disability for the rest of your life, in fact. And I've seen examples of that. But it's also on the positive very manageable, and if you do understand it, and if you're fit and it's early enough in life, then it shouldn't cause you many problems at all, provided you understand how to you look at particularly at what the triggers might be for you as an individual. So there's very much a positive element to it. It's not something which really should dramatically affect your life, provided you keep on top of understanding it. But the significant bit is, for me, is making sure that I do understand it for the rest of, that it's something that might well impact me later in life. And then things can become perhaps a bit more serious if I wasn't to treat it. And as I've got family members, we've sort of seen the effects and the treatment that you need, and there's certain drugs and things you need to be aware of if that does happen later in life. But I think it's about education, it's about understanding and providing information so that people know what to do and understand how to recognise it. It's very simple once you've for me anyway, understanding what a normal sinus rhythm is, that regular heartbeat, and then understanding when that's not normal, when it goes arrhythmic. So for me, that's the indicator I always try and check on. I don't know whether that's accurate medical advice, but
it is. I mean, normally, I think the truth of the matter is that there is no better judge of an athlete's body than the athlete themselves. So when an athlete tells you that they don't feel well or something's not right, even when their parameters are looking okay, instead of saying there's nothing wrong with you, the fact that the athlete has noticed that there is a significant problem means there is something, and we just haven't found it yet. So you've got to keep looking until you're absolutely sure that you've excluded everything. So, and what about advice for coaches? Because of course you were quite lucky that you've got a very switched-on physician, and you're a very privileged member of our sportsmen. Not just because of your prowess and your ability, and of course your achievements, but just with the sort of organisation that you're affiliated with. They take athletes' health very seriously. That's not often the case with all sporting disciplines, especially those that aren't financially well endowed.
Well, I think the advice is actually that is much more common than you probably realise. When I got treated, the number of people who came forward saying they'd had the condition or symptoms of it in the past and looking for advice was a very significant number of people, and particularly in rowing, which is obviously an endurance sport, and you do find tall males. The advice I'd give is again education, understanding that this is something that's quite common, and then listening to the athletes, because obviously with sport and something where you have to push yourself, there's an element of being tough, and particularly with training, turning up and going through the paces every day and doing it part of a team. But then there's also that line where you do have to, we've all got our own physical parameters, and it's about listening to the athletes and learning how the athletes sort of behave to different training, so that when something does get wrong, whether it's heart problem or whatever other injury, then you can respond to it quickly. Not something that then gets dragged on because the athlete's always trying to push on and be tough and get through the next session. That's where the line is, and that's where I think a lot of coaches. That's where when injuries carry on and become exaggerated, is when those boundaries are missed, I think.